Hello everyone, it's me Dr. Ayaz Ahmed. I am working as an aesthetic dermatologist. Today I will discuss one of the most important topic of dermatology. The name of topic is Behcet disease. Hopefully you will learn and subscribe my YouTube channel. Definition: it is a multi-system inflammatory disease of unknown etiology, classified as vasculitis and neutrophilic dermatosis, involving all type and size of blood vessel. It is also known as the Behcet syndrome or malignant ophthalmos. Epidemiology: age, sex, and ethnicity and associated disease. ABD has worldwide occurrence. It is endemic in Eastern and Asian countries, but it is rare in Europe. The prevalence in Turkey is about 80 to 420 cases per 1 lakh population. 7 to 30 patients per 1 lakh population in the rest of the continent are seen. Affected age group is usually 20 to 30 years of age. It is equal in both male and female. It is common in Turkmen and Mongol descent. It is associated with recurrent osseous osteomyelitis. Pathophysiology: there are lots of factors which are involved in its pathophysiology. These factors are genetic factors, infectious agents, environmental factors, immunological mechanism, endothelial and clotting factors have been implicated. The pathophysiological features are vasculitis, thrombosis, neutrophilic vascular reaction with endothelial swelling and extravasation of erythrocytes, fibrinoid necrosis of blood vessels. These all are seen in a patient of Behcet disease. Moreover, viral and bacterial infections are also noted, which can cause immunological mechanism of disease. Autoimmune mechanism: the pathology reaction induced by a rapid accumulation of neutrophil and later by T lymphocytes and monocytes and macrophage at needle prick site. Increased T cell, especially helper T cells 1, induces immune response by interleukin 12. Moreover, defective T cell immunity and B cell activation is impaired. Increased level of heat shock protein specific antibody in serum is found in a patient of Behcet disease. Interleukin 1, 8, 12, 17, 22, 23 and 33 and tumor necrotic factor alpha are increased. Interleukin 8 is a sensitive marker of disease activity. Clinical features: the clinical features are recurrent oral ophthalmos ulcer. This recurrent oral ophthalmos ulcer is seen in 80% of cases, and genital ulcers, ocular lesion which may lead to blindness, arthritis or arthropathy, vascular, cardiac, gastrointestinal, neurological, pulmonary, psychiatric, epididymis findings are also seen. This picture describes clinical features of Behcet disease. The most prevalent clinical features of Behcet disease is ophthalmos ulcer. You can see in picture A. This ophthalmos ulcer is a typical lesion having sharp margin with fibrotic base and surrounding erythema. It is painful and it measures about 1 to 3 cm in diameter. You can also see this same lesion in B picture. In first picture the oral cavity is involved, in second picture genital area is involved. Moreover, the lesion in oral and genital area are very clear and visible. You can also see vascular changes or vasculitis in shin area in C picture. It also involves trunk area, especially on the back, and ocular area is seen in E picture. This picture describes the fundoscopy of a patient with Behcet disease. You can see the vascular changes on the back of retina. These vascular changes or vasculitis may damage vessels and lead to blindness, especially in posterior uveitis. In patients of Behcet disease, ocular changes include pus formation in anterior chamber of eye and posterior uveitis that may lead to blindness ultimately. This is another picture showing the similar lesion on oral cavity, hand and shin area. There is no any specific test to diagnose for the Behcet disease, so we usually use revised international criteria for diagnosis. This revised international criteria includes point system. For example, if recurrent ocular lesion is there, the points will be given 2. If ophthalmos recurrent oral ophthalmos is there, the point will be given 2. If recurrent genital ophthalmos is there, the point will be given 2. And if skin recurrent lesion are there, the point will be given 1. If CNS system is involved or if CNS lesion is there, the point will be given 1. And if vascular manifestation are there, the point will be given 1. And if positive pathology test is there, then point will be given 1. Always note that score greater than 4 indicates ABC disease. Though the main scoring system does not include pathology test, where pathology test is conducted, a positive test may be included for 1 extra point. Thank you very much. Stay connected and subscribe my YouTube channel.